Vaccines and the vaccine regimen in terms of, what am I advising, and, when do you begin and when do you stop? I'm advising just 2 series of vaccine boosters, one at 8 weeks, one again at 12 weeks. And obviously in that really young age, that's the most critical time to prevent these serious infectious diseases. In these very small kittens, very small puppies, they really are underweight. I definitely prefer to wait a little bit longer, perhaps until they are 12 weeks of age, and then you can add 4 weeks of that before you give that following booster. Avoid the traditional third booster, which has often been given in puppies. Really not necessary now, especially with the newer vaccines and some of the newer research. So for what I'm saying, for puppies or for dogs, it should only be vaccinated for Parvo virus, which is a modified live vaccine, and distemper virus, once again, is a modified live vaccine. You can wait until 6 months before they're given the rabies vaccine. Some people will give it earlier. I think it's better for their immune system to deal with it at the age of 6 months. Bordetella or kennel cough only needs to be given, if it's required, because they're going to a kennel or they're going to a puppy class and they require that. Kittens, once again, you want to vaccinate for the respiratory viruses, FVRCP, so feline viral rhinotracheitis, feline calicivirus, feline panleukopenia. Definitely of all the ones you're going to give, you want to give is the feline panleukopenia vaccine. Feline leukemia, in my opinion, is not a core vaccine. Should only be given to high-risk cats, so that you're living in a multi-cat household or near an area where there's a large cat population, such as your cat's living in a barn. Very unlikely. Rabies, once again, if you need to give it, you can give it at 6 months. That being said, if you've got a 100% indoor cat not being exposed to any other cats, I don't think it's necessary. You could avoid all those vaccines altogether. Obviously that's different for some of the dogs too, but we have some dogs that are much higher risk. For instance, when we look at, a lab like Lewis, the big lab puppy, he was ready to go to the dog walk as soon as he could walk around, exposing himself to lots of different smells, likely areas where Parvo virus exists. Really important he gets Parvo vaccine early on. But for instance, when you've got a small little lap dog, such as a little Shih Tzu, a little poodle, who's having limited exposure to the ground, never mind other dogs and other diseases, in that case, it's very safe to wait. At least you don't necessarily have to start at 8 weeks and giving them that vaccine then. It'd be fine to perhaps wait till he gets a little bit bigger and start at 12 weeks. Avoid some of the non-core vaccines. In my opinion, you don't need to give coronavirus. You don't need to give leptospirosis. You don't need to give Lyme disease vaccine. You don't need to give Giardia vaccine. For instance, with leptospirosis, a whole number of serovars that actually cause leptospirus, and in many cases, but what's in the vaccine is not necessarily protective. For instance, once again with the cats, FIP vaccine has been shown not to be very effective. No need to give it, as is feline Bordetella, as is feline FIV vaccine for cats. And really limited use of feline leukemia vaccine. All those considered core vaccine, all those vaccines were once considered core, in my opinion, are not especially necessary. From there, we want to give boosters at a year, and then every 3 years until the ages of 10. Some of the other things, you just never vaccinate a sick or a weak animal. So if your dog is not feeling well, they're sick or they're weakened, just avoid the vaccines. If they're showing signs of allergies or they're showing signs of vomiting or diarrhea, just wait until they feel better. You've got a cat or you've got signs of the flu. Wait until they're feeling better before you're going ahead and giving those vaccines.